Good afternoon. So Garth mentioned earlier that Joan sort of changed the trajectory of this session. She also changed the trajectory of my talking points, which is not uncommon. You come prepared with how you're going to present things, and she always gives you a different or enlightened perspective to sort of think through. And so it's not looking, as one of the slides mentioned, through for a different destination, but looking through a different set of eyes. So I'll sort of share with you in sort of 5 minutes or so, how I arrived to where I am. And a couple weeks ago, I happened to be with a group of women physicians, and someone asked me, "How did you kind of end up as a health commissioner?" Because I surely didn't walk into medical school. She works at the FDA, saying that I want to work at the FDA someday, and I'm like, yeah, I didn't walk into medical school saying I wanted to be a health commissioner either. And I didn't finish the fellowship that Joan mentioned earlier, saying that I wanted to be a health commissioner either. I also applaud those people who had tremendous clarity knowing that they wanted to go in academic medicine, too, because I didn't have that as well. I was one of those people who, now when I communicate with medical students and people who are in residency, I'm able to articulate it in a much more coherent fashion, that so many of us spend our lives on this sort of academic or educational conveyor belt. You know, you go through K through 12, and then you spend 4 years in college, and you go right into medical school, and then you do a residency, and then you really don't want to grow up then, so you do a fellowship. And so you're speaking to someone at the end of residency or at the end of fellowship, and they ask you, well, what are you going to do? And many of us have this fear of trepidation that whatever we choose to do at that moment will be what we must do for the rest of our lives. And I think that there are a generation of people who are sort of in my group. I'm clinging on to this young thing very well. I like this, being on the panel of young leaders. We hold on to this fear of whatever it is that we commit to or choose to do, that's what we're going to have to do for the rest of our lives. And I think we're more so embracing that our next job is just that, our next job, and wanting to be receptive to this fact that we're having a circuitous career path, and wanting to have people be in our support system, or this network that we've talked about a little bit today, who want to help mentor and nurture us, recognizing that we may have a circuitous career path. And what does it mean to be able to manage folks like myself who want to be able to be open to that type of professional trajectory. And so I immediately after fellowship ended up in academic medicine. And so someone who has this health policy bug, who ends up in academic medicine, who I believe negotiated the right contract, that should have allowed me to do a lot of good policy work. And when you want to do policy work, policy doesn't move at the same speed of clinical medicine, right? So if you're interacting with a city council or a state legislature, and your goal is to be able to do translational research, T2 research, the one paper I wrote that one year I was in academic medicine, you have to be able to be responsive to these policymakers who really want to do the right thing, but don't have that information at their fingertips. And they don't recognize that you've got a slate of 12 or 15 patients in primary care who are waiting for you to come to clinic, or you were just maybe, not me because I negotiated the right contract, on call the night before. And so you have to be in an environment that's supportive enough to recognize the flexibility you need to be in the policy world. And so I quickly recognized that painting the office orange and not having enough flexibility wasn't the type of environment that was going to be befitting for the policy career that I had, and perhaps I needed to try something differently. So after being in academia, I sat down a few months into it and said, what are the types of career experiences I think I need to have to really do whatever it is I want to do on this circuitous career path? And I didn't do that very specific things some people try to convince you to do. Where do you want to be in 3 years? Where do you want to be in 5 years? Where do you want to be in 10 years? I just wrote a bunch of stuff I wanted to do that I would think that at the end of whatever this life is for me, I would have made a difference in this world. And those experiences could come at me in any order, and I just had to be able to be able and ready to receive them, right? They just needed to feel like it was the right thing to do at the right time. And so I sort of set out to get out of this really good contract I had negotiated and in academia and be open to these opportunities to come. And so I was able to get into a sort of a mid-career program that having a really good network of people that I was able to reach out to say, I don't think this academic medicine is a good fit for me. Recognizing this, and this is all in the context, right, I'm gonna stay on message, but this is all in the context of what we understand improves health outcomes and helps us to achieve health equity. We know all this can't be done by clinical medicine, right? So we have to have people in places and spaces outside of the clinical medicine realm, and recognizing that we need physicians who are professionally trained and understand what needs to be done for social determinants of health and all of these other things. So I'm making these decisions and recognizing where I need to be planted to have a specific amount of influence in order to end health disparities and achieve health equity. So I get into this mid-career program experience, and in about 3 weeks into working at the DC Department of Health, they're like leadership role. So I end up in a senior leadership role in that department. After 2.5 years, I get recruited to go lead the Department of Health in Louisville, Kentucky. And then after 3.5 years there, I get recruited back to lead the Department of Health in DC. And none of these experiences have been without their own challenges. Having a strong network of mentors, two in particular, have been really helpful for me. And one of the things that has been challenging for me is recognizing that there hasn't always been a really good succession plan when it was time for me to leave one role and move into another one. And sometimes that has been my own fault. And sometimes it's not a problem that I've created on my own. I've always had, and sort of to Dr. Landry's point, this philosophy of beginning to mentor right away. So you walk into an organization, you begin to mentor right away. You present at a panel like this, and someone walks up to you and they say, I want to take your job one day. You say, no problem. Email me, let me help you figure out how to do it. And you begin to help nurture that person, not as a way of creating a carbon copy of yourself, but helping them find their best selves. And so I have been fortunate to encounter people who recognize that. I have also been unfortunate to encounter people who have tried to make me carbon copies of them when that's not really what I needed. I needed someone to say how to survive in academic medicine. I needed someone to say how to survive in government, how to not compromise your integrity, how to recognize that being a servant leader and having personal success are not mutually exclusive constructs. So those are the types of things that I think people who are in positions of leadership can recognize and add value to people who are coming after you, and that you need to be able to seek out. If we don't have a great succession plan, all of the good things that organizations like NMA, or all of the great things that you've seeded in your own institutions will fail and flounder. We don't do ourselves any favor by not planting people in our own organizations, by not recognizing what the strengths are in individuals, and then identifying experiences to give to them to make them your replacement. I mean, all of us will move on one day, and we need to make sure that we have people in place behind us. And so I think that the other things that have been extremely important for me is recognizing when we need formal leadership opportunities and when we need to embrace those informal leadership opportunities that we have already had. Sometimes we fear being called a leader, and that is, I think, a really bad thing. This past weekend, I celebrated a 20th reunion of something, and and I had the opportunity to run into someone who reminded me that I worked with him when I was still a college student to start a program, because I'm from about an hour away from Detroit. I'm from a place called Flint. So most people hear only bad things about Flint. So I'm from Flint, Michigan, and I went to University of Michigan in Ann Arbor. And when I was a college student, I recognized that most of the recruitment for diversity came from Detroit. So most of the recruitment that they wanted to do for minority students came from there. They'd bring up busloads of kids. They'd get all of the high grade point average kids they needed from Detroit. Those kids had a great path to scholarships. No one was doing this for my hometown. I called someone and was like, we can figure this out. The first year, they all stayed with kids, my friends in the dorm. We just figured it out. That program ran for 10 years. 40 students from Flint, Michigan were admitted to U of M as a result of that. I hadn't graduated. So those are the types of things you can do before you are a full professor. Right. Okay? So, I mean, and those are the types of things I think are really important for what it means to become a leader and what it means to be able to recognize future leadership potential. So I'll stop here and then be ready to take questions when we get to that point.